Good morning everyone, and welcome back to another day in the life video. I'm heading off to clinic right now to start off the week. I am excited because we should have a completely new caseload since at the end of last week we were really just kind of picking up all of the orthos and all of the extra bits because we didn't have any rehab patients at all. So hopefully over the weekend we were able to pick up some, and maybe there will be some to pick up at the top of the list. So it should be another day of probably a good amount of evals, but I'm hopeful that we will start up our rehab schedule yet again so that I can get more practice with that in our final month of the experience. So yesterday at the end of the clinic day, we had a Zoom meeting where we kind of got on with all of our ICE groups, which was our first 2-week clinical experience with our groups of 4. I was in a skilled nursing facility, and it was so fun getting to hop on the call with them again and kind of reflect on how far we have come since that first experience as a whole. And I think one of the biggest things that one of my classmates said, shout out to you, Dylan, was that some days you feel like you know everything and everything's going so well, and other days you just feel like you aren't helping anyone get better and you're just having a bad day. And I feel like that was kind of what I had saw to a lesser degree from Thursday from last week into Monday of this week, where Thursday was really long, lots of new things and lots of hurdles to kind of figure out. And then yesterday I was able to come in, even with some new patients, have some great experiences, feel like I had an impact on everyone. As I was saying before, I had the opportunity to work with a patient who had lots of anxiety for physical therapy prior to my arrival, and just kind of had a chat with them about what our role is exactly in the inpatient setting, because I think they were very stuck in what they had in outpatient for physical therapy. And as a result, they were pretty stressed because they were in a lot of pain and everything. And after having a conversation with them, meeting them where they're at, and just progressing as we were able, they were able to have such a positive experience, and we're so thankful that I was so nice and was able to just allow them to do what they can do, and of course try to push towards what we are able to do so that I could see their best mobility at this point in time. But I wasn't in a rush with them because they still have a lot to have medically managed. So overall, it was a great day, and I'm excited for another one today. Well, yesterday was another great day. I got a free shirt. As you can see, I'm wearing it right now to start off the morning yesterday. So that was pretty wonderful. A great way to start off the morning, getting something free and a good shirt at that. But yesterday during clinic, I had the opportunity to work with a couple of the other therapists' rehab patients, just because they had to go to other clinics and help with those type of things, and since our schedule was pretty open, we were able to take them on. So it's great to kind of hop in, get to spend some time with some of the rehab patients that I've seen and interacted with but not actually been the therapist for before. So that was super fun, and I think I'm doing a little bit more of that today because some of those same therapists have to go and take care of other things. So it will be another great opportunity for me to continue with those rehab patients and kind of try to progress them based on the handoffs I was given from other therapists, which will be a good skill to continue to work on. But I'm excited for another day. We are almost at the end of this week, and the rest of this experience is definitely going to fly by. I was counting through it this morning, and I believe, including today, there are only 11 days left in clinic for this experience for me, since next week will be Thanksgiving, so gotta make the most of it. Yesterday was quite a busy day just because at clinic we were covering some of the other rehab therapists' patients while they were gone, but that was a great experience, especially because one of them is going to get to go home today, so I'm super excited for them, as well as one of the friends that was made by my rehab patient that discharged not too long ago is also discharging today. So it's really exciting knowing that both of them get to go home, but just getting to work with them and have a rehab patient again was just exciting and nice to have that kind of schedule in your day, both in the morning and afternoon, where you're consistent with that patient and can really focus on your progression of interventions. And it was also a big day for one of the patients that I have been seeing for a couple days now, and they have been having immense pain, and we achieved one of our long-standing goals since I started seeing them, where we made it to the hallway in terms of walking. Of course, they had to fight through pain and everything, but they were able to do it, and that's the big thing. And then, of course, in the evening, I got to go and see Hamilton with my girlfriend, her sister, and her mom. So that was a great way to end the night, but it definitely made it busy coming straight out of clinic and then making sure that I catch the train over to meet them downtown. But I'm excited for today. It's 10 days out in terms of actual clinic days from my final day, so it will be a great opportunity to again see some new patients, because since we don't have those rehab patients we were working with yesterday from the other therapists, we're going to be picking up a lot more evaluations and newer things from the top of the list. So hopefully there will be some fun things to work through and we get to have an impact on all of these kids' days. Well, it was so wonderful to end the week getting to send those rehab patients home and see their happy and excited faces as they were leaving the hospital. So it was just a very positive day overall, even with some of my patients, where we got to progress in our mobility. And one of my patients I've been working with for a while, who has had so much pain, we had a meeting with the medical team where I actually rounded with them on this patient and kind of spoke to what I think is the biggest recommendations. And in the end, we came with the goal of, if they can reach certain goals within PT of walking 50 feet without a break and being able to navigate up and down the 4 stairs that they have at home, that they would be all set for discharge. And I think that that gave some great motivation to my patient, because then we split it up between 2 kind of different sessions throughout the day based on how their pain was doing, and we managed to knock them out right in those 2 sessions, the first of which was right in front of the medical team. So I think that that was huge for them to be able to see, and credit to what we can do as physical therapy and motivating our patients to really get those things done. So it was just a really great day overall. But that brings me to the end of this week. If you enjoyed the video, make sure to hit that like button and subscribe down below, as well as check my link in the description for 20% off Picmonic. Feel free to use their 5-day free trial to see if it's right for you. But I only have a few weeks left. It's crazy. I believe it's 9 days in clinic left, because this next week is going to be Thanksgiving. I just have Monday through Wednesday, since Thursday is off for Thanksgiving. The following week is going to be a full week, and then I'll only have 2 days left after that. So it's going to fly by. If you want to see it, make sure to look out for those videos as they're coming, as well as some other videos that I'll try and post on Thursdays. But thank you all so much for watching. This has been DPT, and I'll see you all in the next video.